Well, hello. I am Dr. Perry Meyer, and I'm the medical director of the Meyer Institute, a center of excellence dedicated to the treatment of the diabetic foot. Now, the diabetic foot is not front and center these days. The COVID 19 virus outbreak pandemic is. And for that, we need to talk. And I think that from a wound perspective, we need to be pragmatic about how we address patients with active wounds and how we triage our patients coming into our office. I think that for the moment, we are going to be scrutinizing the appointment lists to try to identify patients who are most at need and are at the highest risk for future problems if we don't get to them. I think that probably the preventative care piece of our practice is going to be curtailed, namely those patients who require ulcer remission therapy. In other words, looking at their feet on a regular basis and doing nails and calluses to keep them ulcer free. Those patients, unfortunately, right now will be low down on the list of our priorities, as the high-risk patients with active wounds need to be seen first and treated accordingly. We are actively trying to find ways to provide virtual care to our patients. That's kind of difficult with wounds that need debridement. But those that don't and are in need of management only, dressing advice, management of acute problems at home for the short term, that sort of thing, those are conditions that we will be addressing day to day and trying to give some sensible advice to you, our patients, and to our medical colleagues out in the field. This is a difficult time, and we're trying to make the best of a bad situation, and we're trying to be innovative. And one of the innovations that we're going to be using is this virtual care. That will be rolled out over the next week or so. We will try to utilize FaceTiming, but there is other more robust and primarily secure modalities that we're going to try to employ. One that involves our electronic medical records, and that needs a little bit of time to set up. But in the meantime, I'll reiterate what the Ministry of Health is asking us to do, is to try to stay away from large crowds, more than 50, and to use caution when interacting with other individuals, staying at least 1 meter apart, but preferably a little bit further, and to sneeze into the crook of your arm like this, or into a tissue like this, sneezing into the tissue and disposing of it, and to use hand sanitizer liberally, or washing your hands with soap and water for a full 20 seconds. These are measures that are important. Finally, once you've got your hands clean, you can't stick them on your face and rub them around, or stick your finger in your nose or your eye or your mouth. That was a bad way, or a good way, of transmitting the virus from a surface that you've touched and introducing it into your body. So don't do that. We will be back with more information about the COVID-19 virus and what to do when it comes to your wound care in the upcoming days and weeks. And hopefully we'll be able to post some more videos when we have more experience with patients and their immediate problems in the upcoming days and weeks. So thank you very much. Again, my name is Dr. Perry Meyer. I am the medical director of the Meyer Institute. We are a center of excellence dedicated to the treatment of the diabetic foot. But we're probably going to be doing some more things other than the diabetic foot in the near future, and trying to do our part to help out with this national, international, world crisis.